Hello, I'm Leon. This is Michelle. We are respiratory care students. Today we're here to demonstrate how to perform tracheostomy and stomach care. And the indication for tracheostomy and stomach care is if there's a trach in place. A contraindication is if the patient is unstable. And a hazard is decannulation. The first thing you want to do is confirm the physician's orders. After confirming the physician's orders, you want to gather all the necessary equipment needed for this procedure, which include BVM, suction equipment, tracheostomy tie, tracheostomy care kit, and sterile gloves. Thank you, Michelle. After gathering all the necessary equipment needed for this procedure, you're going to wash your hands and don the appropriate PPE. Wash hands, don the appropriate PPE. After washing your hands and donning the appropriate PPE, you're going to introduce yourself to the patient, explain the nature of your visit, confirm their identity. Today we have Mr. Jones. Hello, Mr. Jones. My name is Leon. I'm a respiratory care student. Today I'm here to do a trach cleaning, make sure your trach stays clean. And can I see your wristband? I just need to confirm your identity. Okay, I've confirmed his identity. Now that I've done that and explained the nature of my visit, I have a side note. When you're explaining the nature of your visit, make sure you explain it in a way where the patient can understand what's going on. After doing that, I want to get his vitals and check for breath sounds. His vitals include heart rate, respiratory rate, and SpO2. And I'm going to auscultate for breath sounds. While auscultating, you could check for airway patency. Now that I've checked for his breath sounds, I see there's a need for tracheal suctioning. I'm going to verbalize the suctioning to clear airways, clear secretions. Get that out the way for now. So, make sure you have this around your neck because we're going to get sterile at some point. You don't want to keep moving back and forth. So, now I'm going to set up my field. Just my mat for now. Remember, the side that you touch is the side that has to face down because this is a sterile procedure. You could pinch the bottom, lay it flat on the table. Now I'm going to remove his dressing. When removing the dressing or doing anything towards the trach and you have to touch it, decannulation is a hazard, so you want to hold down the flange. You're going to remove his dressing, throw it in the garbage. Now that I've done that, I'm going to remove my hydrogen peroxide and my sterile water. Sterile water, hydrogen peroxide. Now I'm going to dump the remaining contents of the tracheostomy care kit onto the mat. Okay. I'm going to pour my sterile water and my hydrogen peroxide into the tracheostomy care kit tray. You're going to dump the water into all three trays. Water, water, water. And the hydrogen peroxide into one tray, preferably the biggest tray. Now I'm going to put on my sterile gloves. Grab it by the cuff. Now use your clean hand to scoop the other glove. Now that I'm sterile, we're gonna separate all the contents of the tracheostomy care kit, pipe cleaner, sterile cotton tip, twill tape, brush, gauze, and a new dressing. Now that I separated everything, I'm gonna remove his inner cannula. After I remove his inner cannula, I'm gonna clean it in the hydrogen peroxide. And remember, when removing anything from the trach, hold down the flange. So there's two different types of inner cannulas: disposable and non-disposable. For today's purposes, we're gonna work with a non-disposable inner cannula. You know, pick up your brush, dip it in the hydrogen peroxide and water, put it inside, scrub real good inside, scrub outside, keep it over the hydrogen peroxide as you're scrubbing. Now that I cleaned that, I'm going to dispose of this and rinse the inner cannula in water. Shake it off. Water. Shake it off. I'm going to put it to the side to dry. Now that I've done that, I'm going to get my sterile cotton tip. Dip it in the hydrogen peroxide. Swab under one time. Garbage. Get my other cotton tip, dip it in the hydrogen peroxide, swab one time over. Remember to hold on the flange. Garbage. Gonna get my pipe cleaner, dip it in the hydrogen peroxide, get those little crevices. Garbage. Now I'm gonna rinse. Dip it in the water. Go under one time. Garbage. Now I'm gonna dry it up. Dry. Garbage. Now that I've done that, I'm going to change his trach tie. Remember to hold on the flange. Holding down his flange. So I'm gonna make sure that it's secured. I'm gonna throw this in the garbage. I'm gonna make sure that it's secured with 2-finger maneuver. Okay, the tracheostomy tie is secured. Now I'm gonna put his inner cannula back in. Now that I put his inner cannula back in, I'm gonna take off my sterile gloves. Put on a new dressing. Now I'm going to auscultate, check for airway patency, his vitals. Now that I've done that, I'm going to dispose of my cleaning utensils to the garbage. I'm going to ensure that the patient is comfortable, and if they need anything else, do you need anything else? Okay. I'm going to remove my PPE, garbage, wash my hands, and I'm going to chart my findings and how the procedure went. Thank you for tuning into our video, and have a great day.